This is the stress coping and adaptation theory presented by Richard Lazarus. In attempting to explain stress as a more dynamic process, Richard Lazarus presented stress as a product of a transaction between a person and his or her complex environment. He built his framework off of Seeley's general adaptation syndrome, off of Batsowitz, Persky's, Korschen's, and Glinker's soldier anxiety associated with fear versus anxiety associated with failure theory, and Mechanics' model of stress. According to Lazarus, none of these theories could exactly explain which factors may lead some people to manage stress properly. He went on to further state that there is a lack in these theories to be able to interpret some of the factors that help people adjust for a longer period than others to a stressful stimuli. This theory is a transactional middle-range theory that has a multidisciplinary approach that focuses on how a person copes with stressful situations, as opposed to Seeley's focus of stress on the body's physiological response. This theory views the psychological responses. Lazarus viewed these responses as a process and states that a process-oriented approach is directed towards what an individual actually thinks and does with context of the specific encounter and includes how these thoughts and actions change as the encounter unfolds. The major concepts to understand within this theory are the appraisal process, the coping abilities, and the outcomes that come from these, also known as the adaptation process. Coping, when viewed as a process, is characterized by dynamics and changes that are functions of continuous appraisals and reappraisals of the shifting person-environment relationship. When we talk about this person-environment factors or patterns, these are identified items that can lead to or influence stressors. This could include personality, beliefs, commitments, social networks, social supports, demands and constraints, sociocultural factors, and life events. The appraisal process consists of three different cognitive appraisals. There's a primary, a secondary, and a reappraisal process in which we will view more closely. The primary appraisal is a person's decision on whether he or she has any stake on an encounter at hand, and if so, what kind. Is there a harm or loss done? Is there potential future threats, or is there a challenge involved? If there is no stake to the encounter, then it's irrelevant to one's well-being. If the encounter is relevant to a person, then the quality and intensity of the emotion will vary depending on the value of what and how much is at stake. The primary appraisal is approached through two different pathways, a cognitive and an emotional pathway. The cognitive pathway observes the stakes a person has on a specific situation in relation to assessing the physical, social, and material goals and commitments that are relevant to that specific encounter. The emotional approaches stresses the emotions people will report in response to a stressful situation. Next, we'll look at the secondary appraisal. This supplements the primary appraisal. Since there is the threat of harm or challenge, the benefit will depend on the amount of control that we think we can exert over the outcomes. Here we can determine how we can best deal with a situation and change the undesirable outcome. We'll evaluate our internal and external coping options, as well as resources to create a more positive environment. This will result in the reappraisal of a stressor and our ability to utilize coping resources. Now, to help manage these demands and emotions generated by stress, coping will then occur. This approach is used to help resolve the primary and secondary appraisal process. Lazarus identified two types of coping: problem-focused coping and emotion-focused coping. Problem-focused coping is said to change the person-environment relationship and manage the actual problem itself. Emotion-focused coping changes the meaning of the situation. It refers to the regulation of emotions that are generated by the appraisal process. For example, one can feel anger or sadness in response to the appraisal of loss, anxiety, or fear, or one can feel eagerness or excitement and worry in the case of appraising challenges. Being able to identify a potential stressor to a patient and helping to develop coping strategies and in turn determine their effectiveness is a major part of the nursing process. Thus, we as nurses have the ability to recognize a patient's needs and reactions. We are then able to choose interventions that will most be effective for a particular patient. Through research, we've been able to identify ways to alleviate stress, such as anxiety reduction, anger management, relaxation techniques, and effective time management. This theory is important to nursing so that we can assess the effects of stress both on a physical and psychological to the individual and help determine the coping process that an individual can use. It's important to remember when assessing these stressors that we assess the meaning of the stressor to the individual and also learn the resources and support that that person has. As nurses, we can help problem solving or cognitive restructuring to assist with coping and adapting. Thus, many of the interventions we initiate during care of a patient are implemented as a response to stress. For a simple example, this can be applied when taking care of a patient in pain. Pain can be viewed as our biological stressor. We then implement interventions for ways to cope or alleviate pain, whether it's using a breathing exercise, distraction, imagery, pain meds, etc. We apply these to the patient and then assess their response and evaluate how a patient would adapt to this pain. The Ways of Coping questionnaire and Ways of Coping checklist was developed as a result of the stress coping and adaptation theory, and this can be used clinically. This helps individuals or patients focus on real-life stressful situations and focuses their responses to a specific situation. This questionnaire consists of 66 items with 8 coping skills. Given its ability to test a large range of coping techniques, researchers utilizing this questionnaire were influenced to adjust the wording to reflect a particular study. Thus, this questionnaire has been employed to investigate a wide variety of stressful situations with many different populations, from children to adolescents, parents to working adults, clinical samples of elderly. Further, this questionnaire has also been translated into many different languages and has been able to use across many cultures. A research study on the work stress coping and stress management assessed how individuals responded to stressors of a working environment. It viewed how individuals perceive factors in the work environment as a threat or as a primary appraisal. They then scanned the available resources. They looked at external or internal to oneself to cope with these stressors as the secondary appraisal. If the coping resources provided minimal relief, the strain or negative attitudes developed. As a result, interventions were focused in order to help with these stressors. These included primary interventions such as stress management, secondary interventions such as coping, and tertiary interventions such as stress management techniques that targeted the intervention for the entire workforce. It has been found that applying these interventions had direct implications on the health of all individuals and consequently the health of the organization. Another area of research in which this theory has been applied is in using this questionnaire to assess coping strategies in patients suffering from fibromyalgia pain. The participants consisted of 501 adults who were members of a large health maintenance organization. Coping was assessed using the Ways of Coping questionnaire. This was a self-administered questionnaire that consisted of 66 items, grouped again with the 8 subscales. There was a 4-point rating scale was used. 0 indicated that these coping strategies did not apply. 1 indicated that these coping strategies were used somewhat. 2 used quite a bit, and 3 indicated that coping strategies were used a great deal. There were no instructions to these participants about using the particular coping strategies or time frame to focus on this event, but the participants did respond on their coping in a more general basis. This study did shift towards focusing on the impacts of the fibromyalgia pain rather than the actual coping of the fibromyalgia pain itself. A final study that I'd like to touch base on with the theory and works of Lazarus was one on the stress and coping appraisal in the HIV positive population. This study looked at individuals diagnosed with HIV infection and evaluated how they may be overwhelmed or isolated, leading to the maladaptive coping strategies, which could result in depression or negative health behaviors that could potentially amplify this disease progression. Within the research, they looked into residents of rural communities that have less access to health and social services for persons living with HIV, and therefore certain aspects of their coping process may be very different from individuals living in a more urban area. Efforts were then made to understand the coping processes of this population that can assist behavioral medicine researchers in designing interventions to address components of the adjustment process, including identifying maladaptive stressor appraisal and coping strategies. This study addressed 2 basic hypotheses from this transactional model. First, matching the hypothesis examined whether control appraisals of life events influenced a person's choice of the coping strategy. Second, the effectiveness of the problem versus emotion-focused coping as moderated by a control appraisal was tested. They as well used a self-administered questionnaire that was completed by 337 people living with HIV in a rural community from the years of about 1997 to 2002. Participants were presented with the list of psychosocial stressors common to HIV-infected persons and were then asked to identify their most important life stressor, as well as their perceived ability to control these stressors. A regression analysis was then used to evaluate the relationship between the participants' appraisal coping strategies and their psychological health. Current versus the future utility of this theory. Currently, this theory is helpful and critical in determining and identifying coping strategies to different stressors. It has become a primary piece to the development of other nursing theories, further nursing research and practice, and its results can be used to influence education not only to healthcare providers, but just as much as patients. First, future utilization of this theory could be used to address coping outcomes on a longer time frame basis. While the research that is done is helpful in learning how one copes to identify stressors, being able to see how a person copes with these stressors over an extended period of time could provide more information to how one's perception of a stressor changes over time and how effective these coping mechanisms are maintained. This can only lead us to having a more holistic, in-depth understanding to the coping strategies we use and their outcomes. I do feel that this theory is ready to support evidence-based practice. As nurses, we're able to recognize the need of stress and apply interventions to help cope and adapt with these needs. Through the development and utilization of this theory, many nursing practice models have been developed that can focus on a variety of different patient population perceptions to their own set of stressors. Whether it is how a cancer patient copes with chemotherapy physically or emotionally, or looking to the psychological effects that one has after a disaster such as 9/11, This theoretical framework can support coping interventions used. We can use the research applied to obtain clinical expertise in the effectiveness of coping strategies and the outcomes that are obtained as a result of these strategies.